Pull up a chair and get comfortable. It's time to talk about your federal benefits. Federal Employee Benefit Coordinators presents the FEBC podcast with Elizabeth Inman and Bryan Fentress.
Hello, hello. Are you like me and you just love filling out forms, especially government forms? Yeah, no. Who likes to fill out government forms? Well, I'm sorry, but that's what we're here to talk about. I'm Elizabeth Inman, and I'm here to talk to you about postal reform once again, the Special Enrollment Period. Now, if you heard my last podcast, you're going to know exactly what I'm talking about. If you did not hear my last podcast, I recommend that you go back and listen, because it's all about this special enrollment period where they're waiving the fees to postal annuitants. That's just a fancy way of saying postal retirees who are 65 or older that did not sign up for Medicare Part B. So I gave a great big long lengthy 10-minute or so background on why we're talking about these forms. Forms, oh my goodness. Yeah, with these kind of instructions. Yeah, on the screen, you're going to be able to see the instructions a little bit better. And on the screen is a link that you can literally go to pick up that instruction page. So if you want to pause right now, you can hit pause. You can tap on that link and get this instruction form as we go through it. I'm going to do the technical stuff first, and then on our next podcast, I'm going to get to the nitty-gritty of filling out the forms. There's 2 forms that's necessary for the special enrollment period. There's a third form that is necessary if you're going to suspend your Postal Service health benefit plans, but we'll talk about those individually. So are you ready? Let's get these little handy glasses on. And let's talk about these instructions. How to apply for Medicare Part B medical insurance, because that's the medical part of Medicare for medical doctors, medical services during your special enrollment period. Now, I know, I am a postal retiree. We're kind of special. We know we're kind of special. We kind of like things done our own way. Normally we'd be pretty excited about having our own Postal Service health benefit plan, but under the circumstances, maybe not so much. But unfortunately, when you pull this up and you look at this, you're going to see that this is for any special enrollment period. Yep, that's right. There are no special instructions just for Postal Service retirees on how to do this. So you got to weed through it. You know, that's really my job. That's why you have me. That's why you can call me 918-396-5171, and the staff in my office are going to help you with all of this, because getting through what's relevant to you as a postal retiree during this special enrollment plan and what's not relevant isn't necessarily that easy. But if it was, I wouldn't be doing a podcast about it. So welcome. I'm glad you're here. Let's start talking about the instructions. So you're 65 and older, you've already retired, and you have Medicare A because you paid for those premiums all the way through your career. That's for hospitalization coverage. But you did not sign up for Medicare Part B, and you've heard about this postal reform, and it's changing everything. No longer are you going to have a health plan identified as a federal employee health benefit plan. You're going to have a new one that you have to select during open season that is for Postal Service health benefit plan. And you're concerned about the coverage, so you're thinking, maybe I need Medicare Part B even though I didn't sign up for it. And you don't want to pay the penalties that for every year past 65 is 10% per year. During this special enrollment period, this form and these instructions are for you. So, you with me? Did you track with me? I think you did. All right, let's get started. How to apply. So a little bit of explanation. I'm going to read from this form. I got my reading glasses on. I want to be very, very disciplined and strict with the way I present this information to you, because this is critical information for you. This is stuff that'll hit you right in the pocketbook. And now that you're on a fixed income in retirement, you want to minimize all those extra expenses. So I'm going to be very careful. I'm going to read a lot of this information to you, but I'll add my explanation so you'll understand it, and it'll be so much more clear for you. So at age 65, most people in the United States should enroll in Original Medicare. That's Part A, hospitalization, and Part B, which is medical doctors and services. However, since Part B has a monthly premium that must be paid, some people sign up only for Part A, especially Postal Service retirees. They don't enroll in Part B at age 65 because maybe they're still working and they're covered by an employee's group health benefit plan. Maybe it's because the health benefit plan that they had from the United States Postal Service was such good insurance, they didn't think they had a need for Part B. Or maybe they have a spouse who's working and has medical coverage under their spouse's employer's group health plan. Those are some of the reasons they give in these instructions. Also, some individuals want to continue making contributions to a health savings plan because of the tax benefits of that. However, if they enroll in Medicare, Social Security, or the Railroad Retirement Board benefits, they may incur a tax penalty from the Internal Revenue Service. In either case, a special enrollment period may be available when it becomes necessary for them to start their Medicare coverage. Now, what prompted this special enrollment period, for those of you listening in, is the fact that they changed from federal employee health benefit plans to the Postal Service health benefit plans, and it was never required to have Medicare Part B for your health coverage before. Now, the new program requires Medicare Part B for the enrollee and their spouse to continue their Postal Service health benefit plans. But you're already retired, you already didn't sign up, so now this SEP is going to allow you, that meets the conditions that we talked about, to enroll in Medicare without having to wait for a general enrollment period, the GEP. This allows for you to avoid having a gap in your medical coverage and to avoid paying that late enrollment penalty that we talked about. So there are limitations, so we strongly advise you to contact the Centers for Medicare and Medicaid Services. It's called CMS. For more information. The contact information for CMS is on the next page, and I'll talk about that when I get to it. Now, lo and behold, I know this isn't going to surprise you, because if you're listening to this podcast, it's because you're probably either already retired, thinking about retiring, or you're needing information on Postal Service health benefit plans. I know you're not going to be surprised to find out that a lot of people don't understand anything about this Medicare coverage at all. They had no clue what I was talking about when I started talking about a special enrollment period. So I've spent lots of time with lots of educational information. If you just go back to the podcast, and when you go back, if there's a podcast that you go back to, obviously there's something in that podcast that you need information on. Copy that link and share it with your friends. Everybody needs this information. I'm trying to give you the information that's not just easily available out there on the World Wide Web. So, how can I enroll in my special enrollment plan? You can use a special enrollment plan to enroll in Part B while you're still in a group health benefit plan based on current employment. Now, I just took a call in my office this week, and the person on the line said that when they contacted Medicare, they told them something different than that. Now, either something different than that was said, or maybe that person misunderstood. But I know I've talked with people that is called Medicare, and they didn't even know there was a special enrollment period for the postal employees. That's a little bit concerning. But that's the world we live in. I mean, if you call Social Security and you want to start asking Social Security questions, it's dependent on the level of knowledge on the person that answers the phone. I tell my folks that if you run across that, ask for a supervisor. Ask for their supervisor. It is very likely that if you contact CMS, the Center for Medicare and Medicaid Services, to ask about the special enrollment period, the person answering the phone may not know what you're talking about. Ask for a supervisor, ask for a manager until you find somebody that has information on this special enrollment period. So, okay. If your employment ends or employer-provided medical coverage ends, you have 8 months from that month, whichever comes first, to sign up for Medicare Part B. This will prevent a delay in the coverage, and it prevents the penalty. Now, the following doesn't count as coverage based on current enrollment. You need to know what doesn't count as coverage. The COBRA coverage that you get offered if you happen to quit and didn't retire, if you left federal service and they offered you COBRA, that doesn't count as coverage, credible coverage. Retiree health coverage, Veterans Affairs coverage doesn't apply as credible coverage for this either. Individual health coverage like through the health insurance marketplace, none of those qualify. So it's important to understand that. You cannot enroll in Medicare using a special enrollment period during your initial enrollment period. Your initial enrollment period starts 3 months before the month you reach 65 and ends 3 months after the month you turn 65. So, if you want to know more about these enrollment periods, you can go online and you can read the Medicare publication number 05-10043, and you'll get all the details you need on that. But for right now, I think I'm going to stop this particular podcast. There's so much information here right now. I'm going to end this particular podcast to give you an opportunity to click the link and get these instructions so you can follow along. Now, I paused earlier, but there is so much information in here and it's such critical information. I'm not going to rush this, and I'm not going to make this into a great big long podcast that nobody wants to listen to. So I'm going to pause, stop this podcast, and in our next podcast, I'm actually going to start talking about when will your Part B coverage start. And I'm going to talk about what happens if you don't sign up for it during the special enrollment period, along with getting down to the nitty-gritty of how to apply. So I've got the complicated version, and then I made a little summary version that'll make it a lot easier for you. How about that? Good deal. I'm Elizabeth Inman, Federal Employee Benefit Coordinators. You can call me at 918-396-5171. Looking forward to talking to you.